My name is Sunil Agarwal. My age is 53. On December 21st, 2019, I woke up middle of the night around 2:30 with 1.5 liters of vomiting of blood. You'll be wondering how I can measure 1.5 liters. Because when I I threw the vomiting, there was a large chunks of clotting which blocked the drain. So I could measure the blood what was come out. And with whatever little knowledge I had that point of time, I knew for sure कि one vomiting or one loose motion of blood, second one and third one 4.5 liters if it goes off, that's the end of the story. So I needed to rush to the hospital. So I did. 30 minutes I reached to the hospital. That point of time, Apollo Hospital, Jayanagar. I was in Kanakpura Road. By the time I reached the hospital emergency, I almost collapsed at the entrance of the ICU. After that, I don't know what happened. I woke up only after next day by I think 11:30 with the beep of the sounds of the machines and everything. Lot of doctors were all surrounded me. That's when I regained my consciousness. That time they told, sir, you have non-alcoholic liver cirrhosis and the blood spleen has ruptured and the blood has come out totally like that. Good thing that you reach in time, otherwise another half an hour you would have been only in the newspapers as Shraddhanjali. So now hereafter your life has to be regulated, and all that gave me was 6 months time to do for the liver transplant. So after that I consulted 2-3 more doctors over here, various doctors, second opinion, third opinion. Fortunately, in Manipal Hospital, I'd like to mention Mr. Amarkishan Shetty, very specifically. He guided me rightly, properly, and he told your case is very difficult. Best is to consult Dr. Mohammad Rela, who is world's best doctor in liver transplants, and he is based in Singapore. Chennai, he's got a hospital where in 10 days, in a month, he stays there, and balance 20 days of the world of he travels. The less said about him, the better as far as he is concerned. His achievements are godly, not any human beings or any superheroes' achievements. He is as good as God's own hands. I have done that. Maybe you can also find out about him. So I consulted him. He saw all my reports. He told, Sunil, I don't think you need to rush for 6 hours. I'll manage you for next 2 years. He gave some parameters on medicine and lifestyle to manage it. We tried to manage it for 2 years. So almost like last 6 to 8 months again things have started complicating and it's been deteriorating continuously. To the extent now there is something called mild score. If it crosses 30, then I'm as good as no life. Or if I'm not operated, it's over. Last week I reached 29.5. So it was almost like, and I don't have energy or even to reach Chennai also. Even 1 hour I cannot be left alone. Out of 40 days, last 20 days I've been intense ICUs, in and out of hospital and wards, and I'm here only. And now I'll come back to the Mana, Dr. Sunita Agarwal. Around, say, January 2020, I was introduced to Mana, and I continued for 6 months. The best part about Mana is my body is adapted so well. The concept about Mana and things the doctor will explain in detail. I can tell you miracles do happen every day, every moment. And my life is also full of miracles, especially as far as the medical history is concerned or body is concerned. Having multiple issues, right from liver cirrhosis to 90% blockage in the head, in the brain, white cerebrum, to the enlarged prostate, hernia of the abdominal, navel, and also something to do with gallbladder too. Sometimes the kidneys also get swollen up. So multiple complications, including celluloids, full body pain. You have to study early that we have 204 bone joints. Here the pain is throughout the uh, all my life, 24/7. I can feel the pain in every joint of the body. Last 25 years, I have not slept more than 2 hours average, to be precise, and my conscience never sleeps. Now, coming to the miracles of mana. After a couple of treatments, especially the mega dose, initially they primed my body to see that adaptability. It was good. My vision, which was just 3 lines I could read that point of time, I went up to the almost 7th line, 6th line clear, 7th line little struggling. And the biggest miracle in my life, to start with about mana, was I was on medication for sugar and diabetes for 12 years. And for sugar, it was Janomet 50 by 1000 mg 2 times a day, which is the maximum. Next level is insulin. Overnight, I was out of diabetes. From that day till today, I have not taken a single tablet of diabetes at all. My HbCl level, which is a parameter of sugar, which is around, if I cross 6.3, you're diabetic and beyond. Mine was 9.5. Currently, my HbCl levels are 4.9 to 5.3. It is as good as an 18-year-old boy. Coming to BP, I had almost liked close to 25 to 30 years. My BP was almost like 140, 150 by 110, like that, never up below 100. And then it came up to 140 by 105, 100, like that. Then 130 by 100. And over a period of time, it was like 125 by 95. It was almost constant, which is almost on the higher side. 12 years on medication for this thing. That also stopped. Overnight, I became normal, 120 by 80 precise. To the extent today, I am suffering from low BP sometimes, because that's the kind of control this mana had done. Unfortunately, due to my own issues, financial and otherwise, I could not continue, and I had stopped in between. Though doctors had told, you are the only one of the patients whose body is adapted very well to this. Why don't you continue? They did not ask me money. I still owe them. I don't want to put in figures, but lakhs of them. Apart from that, the gratitude of life, what they did for me, I can never forget. But for them, I would not have been today alive. Even now, when I knew my bilirubin went up to, and that was the last stage, and I cannot reach Chennai, I just called once. Within 17 minutes to be precise, Mr. Pankaj is you and doctor's husband. This is the location. I was there. He brought me, said, I never asked for money. Come, first I'll treat you. In the last 1 week, I've been taking treatment. My bilirubin has come down from 29.5 to 18, which is a miracle. Even doctors cannot believe now. And I'm almost at the threshold of, if it goes below 15, I don't need a transplant immediately. I can extend the time. I'm sure with things going in, what doctor has given me a very good chart. Says maintain consistency of this level now. Slowly will increase the dose when it's required. She made a beautiful chart. I'm following it in toto, and it is working wonders. Why she is so sure about it is, she died on herself, her life story. You'll know from that extract. She said, I'm only not doing any experiment with you. I'm only going for tried, tested, proven thing which has done for myself, I'm doing to you. I don't want to experiment. Once it comes to one stage when you recovered fully, then we'll see how we can eliminate totally. Thanks to her. Apart from that, I'm just also doing some Ayurveda. I think these are the only thing which will work for me or for anyone else that matter. Allopathy, I don't want to show disrespect. It has got its own plus and minus points. I'll leave the subject because it's a controversial thing. I'll leave it at that. But I'm thanking once again, if I can put it in Hindi or Sanskrit, कृतज्ञ से डॉक्टर उनके परिवार, मेरे परिवार, मेरे दोस्त, सारे वेलविशर्स का जो मेरे को आशीर्वाद मिला है, प्यार मिला है, स्नेह मिला है, और भगवान मेरे साथ में हमेशा रहा है, बस उसकी वजह से मैं जी रहा हूँ और मैं जीऊँगा. इस लड़ाई को मैं जीतूँगा. 100% for sure, whatever it may happen. I will win, and I'm a winner already. I can see that I'm there. I'll live my life at least 90 years, record my words, record my writer, and I'm there. And I'll give back to the society much more than what I have taken from them. बहुत बहुत धन्यवाद, शुक्रिया, थैंक यू, कृतज्ञ, नमस्कार.